MEDSTAR. This is our main entrance, and you see here we provide valet service for our customers who are coming. So there is an easy parking facility available. That's our in-house pharmacy. So after patients have diagnosed and if they want to buy something, we keep here. We have a huge stock of homeopathy medicine, which is one of the alternate consultation, prescription or treatment we provide here. From here you see all our consultation rooms are there. 7 plus 2, 7 on the illness side, and far down the alley you see a door beyond which we start our aesthetic area. So we have homeopathic here, internal medicine, we have gynecology, an obstetrician, we have general surgeon, we have dermatology, we have ENT, we have orthopedic surgeon, and from here we start our aesthetic area. We have 2 dental doctors on board. This is our counseling, and we go towards the end. This is our waiting area for the aesthetic patients, and there is another door and there is an elevator behind this wall which is exclusive for us, so VIP patients can come in and discreetly come in from here and go directly from the parking. This is the
Hello and a very warm welcome to all our viewers. My name is Laura and we're here at the MEDSTAR Daycare Surgery, and joining me is none other than the man behind it all, and we're talking about Mr. Alnoor Drolia. Hello and a very warm welcome. How are you doing?
I'm well, Laura. Thank you.
It's a pleasure to have you with us on the show today.
Pleasure, very pleasure to be here.
Now tell us a little bit more about the history and background that goes behind this wonderful daycare surgery that we're in today.
Fantastic. So MEDSTAR Day Surgery is a day center, which means that we do procedures that only require you to be here for the evening, and you're discharged in the evening to go home and recover in the comfort of your own home. We have multidisciplinary family health as well as aesthetics. The surgery center is about 4 years old. Mm-hmm. We have recently just acquired it, right? So I'm the managing director and lead investor. Mm-hmm. We're looking at bringing some technological changes to enhance the experience of the patient, whether it is for aesthetics care or it is for family care.
All right. And I mean, who would you say are the patients that you expect to see here at MEDSTAR?
So it could be anybody that requires any type of medical attention. Mm-hmm. We are not an emergency response center. It's not meant to be that. Mm-hmm. It's meant to be people who have booked appointments, who are coming to see a specialist. Whether, like I said, whether it is for wellness or it's for any sort of ailment that the patient is going through. So anybody can walk in.
Okay, and you even offer plastic surgery over here at the center.
Yes, we've got some leading plastic surgeons on board. We're also recruiting some others, well known, that are coming from abroad, predominantly from Europe, that are coming down and taking care of our patients here. The center is very conducive for that. We have 2 operating theaters. We have one for small procedures as well. Plus we have recovery rooms. We have private recovery rooms as well as general ones. Okay. So again, very conducive because of the specialists that we have on board.
Okay. And last but not least, what would you say differentiates MEDSTAR Daycare Surgery from any other hospital here in the region or clinic?
Okay, I think primarily it's innovation. Mm-hmm. When we're looking at day surgery, today there are day surgery centers that are affiliated with hospitals. The problem with that, I think, is really looking at the cost efficiencies and the patient experience. Today, our drive is what we're telling our doctors that are on board. Look for innovation. Look for ways that we can reduce the cost, whether it is self-paid client or a patient, or it is covered through insurance. Today, the costs of medicine are going high. True. We have to try to find ways to curtail that. And that, I think, is through innovation. We are very open-minded. We're aggressive. We are entrepreneurs by birth, by blood. Mm-hmm. So we're looking at ways of keeping the costs down. If we can keep the costs down, we can pass them on. And I think that today, medicine is getting a little bit too expensive.
Very true.
So we want to look at that. Innovation, we want to look at specialists, and we want to look at multidisciplines. through a standalone day surgery center.
Alnur Drolia, what message do you have for the viewers that are watching us right now? What would you say to them regarding MedStar daycare surgery?
So it's an exciting opportunity. It's an exciting time. Medicine is constantly on the change. We want to build a center of excellence. We want to make sure that anybody who walks through the doors of MedStar has an extremely positive experience. They should go home and they should feel that MedStar is their first choice when it comes to healthcare.
Alnur Drolia, thank you very much for joining us on today's
Lara,
show.
you've been very kind. Thank you.
It's been a true pleasure talking to you and wishing you continued growth and success.
Thank you, Lara.
Thank you. Unfortunately, that's all we have time for from Mr. Alnur Drolia, the man behind MedStar Daycare Surgery. My name is Lara, signing off. Until next time.
This is our dermatologist where doctor sits and operates. She consults about all dermatology related issues to our patients. Those are a couple of machines which we use. That's a hydrofacial, that is microcrystal diamond peel machine. This is our laser treatment room, Soprano Ice 3. This is one of the latest machines, and we also have Vela Shape 3 that is used for body contouring, removing of cellulite, etc. And that's our CO2 machine used for removal of scars and many other treatment. So these are our post-procedure surgical room. This is a typical cabin. We have about 6 of them. These are fully equipped with a waiting area for a family member. We call them cubicles. This is one of our VIP recovery rooms. They have their own dedicated washroom, more privacy, little bigger, and lounge chair and a TV. So I'll take you to our ICU room. This is an ICU in case we need. So this is fully equipped as per the regulations. You may find it similar to a VIP room, but more than a VIP, this is an ICU.
Okay.
Yeah.
Got this. It's okay.
So this is one of our typical consultations room. This is our ENT room, and that's our doctor, Dr. Irshad. He is an ENT specialist. I'll let him explain his area and his equipment.
Okay, I'm an ENT specialist. I'm an ENT surgeon. I'm operating ear, nose, and throat cases. This is the ENT examination unit with a fully automated ENT chair. We have monitors to do endoscopies and record them. With the patient can see the procedure as it is being done. So we have a full-fledged unit with endoscopes, with the atomizers, suction, irrigation channels, recordings, temperature-controlled instrument panel, and the computer system for the recordings. Okay, and the medications to be used kept here, and instruments which are sterilized and kept in packages are in both these cabinets. So that's basically how we're doing it here. And we're doing the full range of ENT procedures, including OP procedures here. We are doing mostly adenoids, tonsil surgeries, septum and turbinate surgeries, snoring, sleep apnea procedures, ear cases, including laryngoplasty, tympanoplasty, grommets. We are doing cobblation assisted surgeries in which we can do most of these cases as daycare, and the patient can go home by evening with them, including the rest period or leaves can be reduced by these new techniques and technologies which we use to do daycare.
Thank you. Nice. So when the patient walks in after registration, they come to this vitals area where we take the basic vital examination. This is one of the examination rooms. We also have a BMI machine. Please, yeah. And these two are where we do the initial vitals, blood pressure, weight, height, etc.
We're still here at MedStar Daycare Surgery, and joining me now is Dr. Raj Kumar. A very warm welcome, and how are you doing?
Great to see you, Lara.
It's a pleasure to have you with us on the show. Tell us a little more about this beautiful place that we're in today, MedStar Daycare Surgery.
So, all over the world, less is more. People want less pain after surgery. They want less bills. They want to spend less time in hospital. And I think a good ambience daycare surgical center fits in with all of these. So people want to come in and have surgeries and go back within a few hours, vis-a-vis staying in for 3-4 days. People don't want to pick up bugs from other people's bugs from hospitals.
True.
So the amount of contact time in the hospital, the less you keep it, the better. So in accordance with that altered thinking that's now happening, we are trying to spend time here, and we've developed that ambience here at MedStar so that patients can come and have procedures early morning and go back by 2 or 3 in the afternoon. Also, Lara, the type of procedures is expanding. Long back, daycare surgical procedures was just for a nail removal or a corn removal. These days, we do almost the 80% of the gamut of general and laparoscopic surgery, the keyhole surgery in here. Gallbladders, appendixes, hernias, uteruses too in some cases. A lot of weight loss surgery is done in the daycare setting. I mean, people can come in, have an endoscopy, and walk out in 3-4 hours, and they will lose 10 or 15 kilograms. The whole trend of surgery is less is more. I mean, look at clothes. People used to wear more clothes, and people are wearing less clothes now.
Very true. I have to agree with you, Dr. Raj.
People are paying big bills. We want them to pay smaller bills.
Very true.
All over the world.
Very true. Now, Dr. Raj, what are the different services and facilities that are available here?
Right. So we have a good general physician here. Your first port of call, pediatrician, general physician, homeopath, general surgery and GI surgery, endoscopy, and then arthroscopy. A lot of joint work. If you're going to transplant or replace a joint, you can't do it in a daycare setup.
Sure.
But if somebody just has knee pain, do you want to put a little keyhole and have a look inside? You can do that here. You don't need to be in a big hospital. So I would say, and then apart from that, plastic surgery or aesthetic or cosmetic surgery, breast surgery, face surgery, belly surgery, they can all be done here. And patients will be home 6-7 p.m.
Wonderful.
The beauty, I'll tell you the beauty.
Please.
We are committing ourselves to sending patients home. We are responsible. We ring them up, make sure they're all right. We set up protocols. It's our responsibility that they have no pain after surgery. It's not a hospital where you can operate and go away, and the nurse will jab the patient if the patient has pain. Here, we are responsible for ensuring that the patient goes home and spends time at home without pain. And therefore, the onus is on us to ensure the patient's comfort.
Last but not least, Dr. Raj, what message do you have for the viewers that are watching us right now?
Right.
What would you say to them regarding MedStar Daycare Surgery?
Well, we're opening our arms out and saying, you guys, please come over and check the experience. First time when I came into Dubai, the Emirates Airlines talked about Dubai being an experience. We're also saying that MedStar, like Dubai, is an experience. I mean, it's difficult for me to explain the color red to you. If I show you the red color, you'll understand. So we'd like you guys to come over, experience the ambience of a daycare surgical center, a daycare center, experience all the various facilities available, and once more we welcome all of you.
Dr. Raj Kumar, it's a pleasure talking to you. Thank you very much for your time and wishing you continued growth and success.
Thank you very much, Lara, and to all of you there. Masalam.
Thank you. Unfortunately, that's all we have time for from Dr. Raj Kumar. My name is Lara, signing off. Until next time. Bye.